Hello students, welcome to this video of galactose metabolism. Before starting on galactose particularly, I will be telling you some basics. Understand the concept. Look, the monosaccharides which we get in our diet are glucose, it can be galactose, it can be fructose, right? Glucose is the main monosaccharide which reaches our system, but galactose also can come from lactose, that is milk and milk products, because lactose contains galactose, okay? And fructose also is obtained from fruits, from honey, and it also comes from sucrose, the table sugar, right? Now, we have already done the metabolism of glucose, how it is taken in the cell. And when we have seen the metabolism of glucose, we have seen that so many enzymes are required for the metabolism of this one monosaccharide. You have done that 8 to 10 are in glycolysis, then so many enzymes in TCA cycle, and then ETC also, okay? So approximately I can say that around 30 to 40 enzymes are required for the metabolism of one monosaccharide. Now the other two monosaccharides, galactose, fructose, are also reaching the body. So body is very smart. Body will not make all the 30-40 enzymes different for galactose, different for fructose. No. What body will do, that body will convert galactose to glucose with the help of 3 enzymes which are required new in this case now. But once we get glucose, then all other same 30-40 enzymes can be used which are already present in the cell, right? So this thing is in order to save energy, because making protein or enzyme is a very high energy consuming process. So cell doesn't want to waste its energy, right? So this way galactose metabolism will be taken, that galactose will be converted to glucose only, and other enzymes of glucose metabolism will be used. Similarly for fructose also, there will be few starting different enzymes, and finally fructose will also be joining the pathway of glucose, that is glycolysis, and then all the enzymes of further enzymes are same which can be used, okay? So such things occur in body, that similar or same enzymes are used in many pathways so that cell doesn't waste its energy in making so many different enzymes, right? One more example I can tell you here. If you remember, gluconeogenesis pathway also uses most of the enzymes same of glycolysis. Only four enzymes are different in gluconeogenesis, right? We did that in gluconeogenesis video. Okay, so this is also in order to save energy, that gluconeogenesis pathway is also using the enzymes of glycolysis, right? So let's start with galactose metabolism. So from food or from diet, we get galactose in our cells where it is going to be metabolized. The first thing for any monosaccharide is phosphorylation for the entrapment of that monosaccharide. So it will be converted to galactose 1-phosphate. Okay. In case of glucose, we put phosphate at position number 6, right? But here, in case of galactose, we are putting it in position number 1. So galactose gets converted to galactose 1-phosphate. Obviously, phosphate is getting attached, so ATP will be used here, and name of enzyme will be kinase. So here it is galactokinase. Right now, galactose 1-phosphate will be converted to UDP galactose. So the phosphate group needs to be removed and UDP group needs to be added. So for this reaction, what is used? UDP glucose is used. UDP glucose is used. UDP will be attached to galactose. UDP will be attached to galactose, making UDP galactose. On the other hand, this glucose will attach to this phosphate, making glucose 1-phosphate, right? The name of this enzyme is GALT. GALT, full form is galactose 1-phosphate. I have taken the name of the substrate, that is galactose 1-phosphate. Work this enzyme is doing, it is transferring uridyl group. So it is uridyl transferase, short form is GALT. So I repeat, GALT is galactose 1-phosphate uridyl transferase. Okay. Now, so this is galactokinase is number 1 enzyme, first enzyme. This GALT is number 2 enzyme. Now, number 3 enzyme is, see, we have got UDP galactose. I told you, main work in galactose metabolism is to convert galactose to glucose. So here UDP galactose will be converted to UDP glucose, right? And here enzyme is epimerase, as galactose and glucose are epimers of each other. Okay, full name of this enzyme is UDP galactose 4 epimerase, because they are epimers at position number 4. Okay, this UDP glucose can be again utilized here in this same pathway, right? On the other hand, this glucose 1-phosphate which we have got here will enter glycolysis. By getting converted to glucose 6-phosphate, it will be entering glycolysis and will be using all other enzymes of glycolysis, right? So which 3 enzymes we have in galactose metabolism? We have galactokinase, GALT and epimerase. Okay. Now let's do the energetics of galactose. So during galactose metabolism, galactose is first converted to galactose 1-phosphate. Then galactose 1-phosphate is converted to glucose 1-phosphate, which enters glycolysis. Okay. See, this UDP galactose which is formed, that will make UDP glucose, that will be circulating in this route only. Okay. So we are not considering that. We have to consider glycolysis route for talking about energetics here, right? Now, when glucose 1-phosphate will enter glycolysis, how it will enter glycolysis? Glucose 1-phosphate will be converted to glucose 6-phosphate, right? And here enzyme will be mutase. Okay. Now, there is no energy used or produced at mutase or isomerase, right? Now, glucose 6-phosphate, this will enter glycolysis. Instead of glucose, directly glucose 6-phosphate is entering glycolysis. So there is no need for hexokinase. Okay, hexokinase normally uses ATP, so there's no need to use ATP at this step, right? But at galactokinase step, 1 ATP is used. Okay, so instead of hexokinase, now galactokinase is using ATP. After that, rest everything is same like glucose metabolism. So we can say that the energetics of galactose and glucose is same. So if they ask you that after complete breakdown of galactose, how many ATPs you will get? You will get 32 ATPs, right? After aerobic glycolysis, if galactose is the starting material in aerobic glycolysis, then how many? Then 7 ATPs, okay? Same like glucose, okay? Now, let's see, deficiency of galactokinase is known as minor type galactosemia, in which only cataract occurs. Let's see how. You know, galactose gets converted to galactose 1-phosphate with the help of this enzyme galactokinase, right? So when this enzyme is not working, there will be excess of galactose. This excess of galactose will be taken up by enzyme aldose reductase, making galactitol, also known as dulcitol, and this alcohol in excess is hygroscopic alcohol, and this leads to oil drop cataract. So very important point, in galactosemias there is oil drop cataract. Okay, now coming to deficiency of GALT, the second enzyme of galactose metabolism. This is most common enzyme to be deficient in galactosemia, and the deficiency of this particular enzyme is known as classical type galactosemia. Here, let's see what happens. So, in this case, which reaction is affected? Galactose 1-phosphate gets converted to UDP galactose with the help of enzyme GALT. So when this enzyme is not working, there is accumulation of galactose 1-phosphate. This galactose 1-phosphate gets accumulated in liver and brain. As liver is affected, so patient will be having jaundice, vomiting, hepatomegaly. As brain is affected, so patient will be having mental retardation, and also it is seen that these patients have high incidence of E. coli sepsis. The reason for this is not known, but usually these patients have high risk of E. coli sepsis, right? Then in these patients, cataract will also occur. See how? You know that before galactose 1-phosphate, which reaction was there? Galactose to galactose 1-phosphate enzyme is galactokinase, right? Now, when this galactose 1-phosphate is in excess, by product inhibition, it will inhibit the enzyme galactokinase. So this reaction will stop occurring. So galactose will be now in excess. This excess galactose with the help of enzyme aldose reductase will be converted to galactitol, and you know that this is responsible for oil drop cataract. So in a patient of classical type galactosemia, there is problem in liver also, brain also, and cataract also, right? And this is the most common galactosemia. Now, one very important point, newborn screening for galactosemias is done in case of developed countries. In developed countries, each and every newborn is tested for galactosemia, and we know that galactosemias are not very common. They're not common in developed country also, in developing country also. But then why developed countries are wasting their time and energy to screen each and every newborn for galactosemias? Why? Because, see, if a newborn has galactosemia, then at what age will this child present? At what age problems will start? Tell me. This newborn must be having milk in his diet. So milk means lactose. It has galactose in it. So within first week of life, the child will present with jaundice. And physiological jaundice also occurs at same age. And this way, we may miss these patients of galactosemias. And if we miss these patients, then, you know, in galactosemia, brain is affected and patient can have mental retardation. So, even if the patient will present very early in the hospital, but still we can miss these patients thinking that it is physiological jaundice. So, that's why it is very important to screen each newborn for galactosemias, right? But in developing countries it is not possible, as money is also less and the doctor patient ratio is also very less, so it is not possible there. So what is taken care in a developing country? In a developing country, whenever a patient of jaundice comes, it is usual pattern that phototherapy is given, right? So if it is physiological jaundice, the child will be relieved by phototherapy. But if some child is not getting relieved by phototherapy, then we have to immediately think of galactosemias, and we have to get the test done for that, so that we can prevent mental retardation in that child, right? Now in galactosemia also, urine Benedict test will be positive. Benedict's test will be positive in urine, because galactose is a monosaccharide which will give Benedict's test positive. But glucose oxidase test strip will be negative, indicating that this monosaccharide is not glucose but some other thing, right? And in the treatment of these patients, milk needs to be avoided, right? So now moving on to fructose metabolism. This metabolism occurs in which organ? The organ is mainly liver, where fructose metabolism is occurring. Then what are the sources of this monosaccharide fructose? The sources are table sugar sucrose. Table sugar sucrose, sucrose is a disaccharide. This disaccharide is made up of glucose and fructose, right? So glucose and fructose will be present in equal amount in table sugar, okay? Then it is also present in sugarcane juice, right? Then fructose, some amount is present in fruits, honey, high fructose corn syrup. High fructose corn syrup, right? Now, next is, let's see how this fructose metabolism occurs, the biochemical steps. So when fructose will enter the cells, any monosaccharide, when it enters the cells, then what will happen? Phosphorylation will occur for the entrapment of the monosaccharide. So phosphorylation will occur and fructose 1 phosphate will be formed. As we are adding phosphate group, so 1 ATP will be used here for adding phosphate. And what will be the enzyme? Enzyme will be kinase, right? So this is fructokinase, and it is the first step in the metabolism of fructose, okay? Now we have got fructose 1 phosphate. The next enzyme is aldolase B. Where you have done aldolase A? Aldolase A, which we did in glycolysis, the substrate of aldolase A was fructose 1,6-bisphosphate, and fructose 1,6-bisphosphate was getting broken down into, so let's revise, fructose 1,6-bisphosphate with the help of aldolase A gets divided into glyceraldehyde 3-phosphate and DHAP, that is dihydroxyacetone phosphate, right? Aldolase A is present in most of the tissues of the body, right? Now next is aldolase B. Aldolase B is only involved in fructose metabolism, and it is mainly present in liver, okay? Now this enzyme aldolase B will break down fructose 1 phosphate into glyceraldehyde and DHAP. So this product DHAP is same for both the enzymes aldolase A and aldolase B. Now this is the second step, aldolase B, okay? Now third step is glyceraldehyde gets converted to glyceraldehyde 3-phosphate, right? So here also again phosphorylation is happening, so 1 ATP will be used here, enzyme will be a kinase, okay? Now When this DHAP and glyceraldehyde 3-phosphate are formed, they are intermediates of glycolysis, so they will just enter glycolysis pathway and will give energy via glycolysis, link reaction, TCA and ETC. All those things will be occurring. Like in previous video also, I told you that in case of galactose and fructose metabolism, only 3 enzymes are different. Rest all enzymes are same like glycolysis. So let's see these 3 enzymes of fructose metabolism. These are fructokinase, aldolase B, and the kinase involved in conversion of glyceraldehyde to glyceraldehyde 3-phosphate. Okay. Now tell me energetics of fructose. Energetics of fructose will be same like glucose, or more than glucose, or less than glucose. Let's see this metabolism, how it is done. You know, in glycolysis there are phase 1 and phase 2, but can we say that phase 2 of glycolysis will be same for fructose also, same for glucose also, right? So the energetics of phase 2 will be same. After that also everything else will be same, but only phase 1 is different for glucose and fructose metabolism. In case of glucose metabolism, in phase 1, in case of glucose metabolism, there are 2 ATPs used in phase 1. The 2 steps are hexokinase and phosphofructokinase 1. Okay, 2 ATPs are used. And in case of fructose metabolism also 2 ATPs are used. You can see this ATP and this ATP at both the kinase enzymes steps. Okay, so phase 1 energetics is also same for glucose and fructose. So we can say that energetics of glucose and fructose is same. So if they ask you fructose after aerobic glycolysis gives how many ATPs, then you will say 7 ATPs. Fructose after complete breakdown will give how many ATPs, then you will say 32 ATPs. Okay, so energetics is same, but one very important point, that as compared to glucose or any other monosaccharide, fructose gets rapidly metabolized. Why this occurs? Because it bypasses PFK1 step. What this means? This means that, you know, for metabolism of any monosaccharide, some rate limiting steps are there. For example, when glucose is taken for metabolism, then the rate limiting step is PFK1 step, right? Any rate limiting step is time consuming. It will take time to occur because it will wait for the activators to come, and when activators are present, only then this step can occur, or the inhibitors should leave, only then this step should occur, right? So for glucose metabolism, PFK1 step is required, which is time consuming. But in case of fructose, there is no rate limiting step. So very quickly, fructose will be converted to pyruvate via glycolysis, and then link reaction will make acetyl-CoA. And acetyl-CoA makes fats in body. So fructose will be rapidly metabolized, fructose will be rapidly converted to fats in body. So therefore this is also considered that fructose is most lipogenic sugar, right? And therefore honey or more of fruit juices, they will increase weight. Okay, so they are not recommended during weight reduction therapies, right? Okay, now let's do defects in fructose metabolism. Defects in fructose metabolism. First is deficiency of enzyme fructokinase. Fructokinase is the first enzyme in this metabolism. fructokinase deficiency will lead to essential fructose urea. Essential fructose urea, which is a benign condition. There is fructose in urine. The name tells you fructose in urine, and usually essential word is used for benign condition. It is benign condition, right? Similarly, like there is essential pentose urea. In essential pentose urea also pentoses are coming in urine, and it's a benign condition. Okay, so it's an accidental diagnosis when patient's urine Benedict's test is positive, but glucose oxidase test is negative. Why? This indicates that the reducing sugar which is giving Benedict's positive is not glucose. So what it is? In this case, it is fructose. Any monosaccharide is reducing. Okay. Now, what happens here when fructokinase enzyme is not present? Then fructose is not metabolized, right? Now, fructose will be taken up by hexokinase enzyme. Not much of fructose will be taken by hexokinase. Only less of it will be taken because this enzyme has low affinity for fructose, but this enzyme hexokinase has more affinity for glucose. Okay. Now fructose will be converted to fructose 6-phosphate, and this will enter glycolysis. So this fructose will not be accumulated in blood. This fructose will not be accumulated in blood because the fructose which is in excess in body, some of it will be going towards glycolysis by this route, and rest all of it will be going in urine because there is no renal threshold. There is no renal threshold for fructose. If even little bit fructose is present in blood, that will be excreted out in urine. Okay, that's why the name of this disease is fructose urea, not fructosemia, right? Because fructose levels are not getting raised in blood, they are getting raised in urine, right? Okay, so we are done with fructose urea, essential fructose urea. Next one is the enzyme aldolase B. Aldolase B deficiency, known as, this condition is known as hereditary fructose intolerance, short form HFI, hereditary fructose intolerance. So what will happen in this, aldolase B enzyme converts fructose 1-phosphate. So the substrate of aldolase B is fructose 1-phosphate. So this will be getting accumulated. Fructose 1-phosphate will be getting accumulated as it is not broken down. So this fructose 1-phosphate will be accumulated in liver and kidney. When it is accumulated in liver, patient's sign and symptoms will be jaundice, hepatomegaly. These two were present in galactosemia, classical galactosemia also, right? Other features from liver, if not treated, then liver failure can occur. Also, hypoglycemia will occur. This point I explained in glycogen video. How this hypoglycemia will occur, this is very, very important, because I told you that fructose 1-phosphate inhibits enzyme glycogen phosphorylase, which is the rate limiting enzyme of glycogen breakdown. So glycogen breakdown will not occur and patient will be having hypoglycemia, as glycogen won't be broken down to give glucose and this glucose won't be coming into blood, right? And this is specially known as fructose induced hypoglycemia, right? These patients have aversion to sweet foods, and we cannot prescribe any medicinal syrups to these patients, like paracetamol syrup or antibiotic syrups cannot be prescribed because they have fructose in them. So in this case, fructose ingestion will precipitate the symptoms. So these symptoms, jaundice, hypoglycemia, right? And if it is not treated, then renal failure can also occur, right? So how to diagnose this? Diagnosis is also same like Benedict's test. Benedict's test will be positive, and glucose oxidase test strips will be negative. And in treatment, avoid sucrose, sorbitol and fructose containing food substances. Why sorbitol? Because sorbitol can be converted to fructose. You can see this detail in sorbitol pathway. So only these two enzymes are important in fructose metabolism, for which deficiency diseases we have seen, right? So we're almost done with the video. One very important point about fructose you can note that fructose entry into cells, unlike glucose, is insulin independent. It is insulin independent, as fructose ingestion will not lead to insulin release. Okay, so this is it with this video. Thanks for watching. Best wishes to you.